Oh, that's nice.
I'm a McTimney chiropractor, which means that the adjustments I use are particularly fast and particularly short. Often people think of chiropractic treatment as being tied up in knots and sat on until you pop. With McTimney chiropractic, the patient is basically passive, so you don't need to adopt a contorted position. And then it's my job to put an energy impulse into the system at the right level. Because we make an adjustment that's very quick and adds a bit of spin, a bit of torque, and then recoils, the treatment feels very light, although it's very powerful. So it's a nice combination that almost anybody can enjoy. Laser is a fantastic adjunct to chiropractic because it lets me get into areas that are too sore to adjust. It brings down inflammation, it reduces pain, it encourages tissue healing, and therefore it lets me get on with my chiropractic job faster and more efficiently. People are sometimes surprised that they come in with a sore hip. Why are you spending time playing with my hand or my foot? My approach is to see the system as one whole system, and if you have a problem in one area of your body, there will be compensations in another. And we might be focusing on the area that's restricted, not necessarily the area that's painful, because what we can treat is restriction rather than pain, but the whole body knows that there's a problem, and therefore the whole body can be helped with chiropractic. Patients will normally come to me directly. When a new patient comes, it's a 90-minute appointment. Have a seat, Sarah.
Thanks.
I need to take admin details to create a file for them, take a history of their, what we call their chief complaint, so that I know why they've come to see me.
I keep exercising and using, doing the same things I was, the step and the running. And I keep having, just every now and again, get a little strain in this left knee, just on the inside of this joint.
That information I then need to put into a full medical history, because certain pathologies will show up in the respiratory system or the cardiovascular system. So it's important for me to do a complete check on how that person is operating. I'll carry out testing and arrive at a working diagnosis so that I can then discuss with the patient what I think I'm dealing with, what their options for care are, what form chiropractic care would take. And it's only by doing that really that the patient can give informed consent to treatment so that their expectations are realistic. We can do a lot, but we're not miracle workers. There's a lot of information we gather, not so much from what a patient says, but how they walk in the door. Very often they'll reveal quite a lot about how things are in their system. Evenly distributed between your feet.
Standing on that one more, I would say.
Do you tend to do that?
I think probably, yeah.
Can you stand face that way? Thank you. I'm just going to have hands on your pelvis. Reaction times can be very quick. If we free up something that was the one thing in the way, then there will be an immediate change and the patient will be aware of something changing immediately. Right, you comfortable there? Reasonable? Good. Okay, your job is to do nothing. That's not to say that if you've had a problem for 15 years, it's going to clear up in one treatment. We need to re-educate the system as to what normal is. I think when patients come to me because they feel that I pay a lot of attention to everything they say, and I think they feel very much cared for. Some people haven't talked to anybody about their life for half an hour solidly in any other context. Breathing's really important. And it's interesting and rewarding to spend long enough to make a good diagnosis. Right, could you get up gradually, so maybe come up on hands and knees, nice and symmetrically. Often people really don't have an expectation that their situation can get better. They've become so accustomed to living with pain or a restricted movement that they think, oh well, I'm just old, or this is just how I am. And to see the relief in those people's faces when we make a change and they start to get their normal function back, I think that is the most rewarding part of the job.